Hey everyone, it's Laura here. So, let's face it, choosing health insurance, not exactly the most thrilling way to spend an afternoon. Shopping for insurance isn't exactly captivating. It might even be less entertaining than watching paint dry. But here's the thing. Picking the right health insurance is actually incredibly important, like crazy important. It's about protecting yourself and your loved ones, and nobody wants to be stuck with a mountain of medical bills they weren't prepared for. In this video, we're going to demystify this whole health insurance thing. We'll break down the key things you need to know to make an informed decision, from understanding your own healthcare needs to navigating the alphabet soup of HMOs, PPOs, and all those other acronyms. We're going to talk about how to make sure your favorite doctor is in your plan's network, because nobody wants to switch doctors when they're already feeling under the weather, and we'll even delve into those sneaky extra benefits that can make a real difference. So grab your metaphorical decoder ring because we're about to dive into the world of health insurance, and I promise, it'll be way more interesting than you think. Plus, by the end of this video, you'll be armed with the knowledge you need to choose a plan that works for you and your family. Okay, first things first. Before you even start looking at insurance plans, you've got to figure out what you actually need from your health insurance. It's kind of like ordering at a restaurant. You wouldn't just point randomly at the menu and hope for the best, right? You'd think about what kind of food you're in the mood for. Health insurance is kind of the same way. Think about how often you see the doctor. Are you someone who schedules a checkup every year without fail? Or do you tend to tough it out unless you're practically dragging yourself to the doctor's office? Do you have any ongoing medical conditions that require regular treatment or medication? These are all super important factors to consider, and don't forget about your family. If you've got a partner or kids on your plan, their healthcare needs matter too. The goal here is to find a plan that's going to cover the basics for everyone in your family, whether it's those annual checkups, the occasional unexpected illness, or managing a chronic condition. Alright, time to tackle the different types of health insurance plans out there. It can feel like a jungle of acronyms, I know, but stick with me. The main players are HMOs, PPOs, EPOs, and POS plans. Yeah, it sounds like someone just threw a bunch of letters together, but each one has its own personality. HMOs, or health maintenance organizations, are like the homebodies of the health insurance world. They're usually the most affordable option, but they come with some restrictions. You'll generally need to choose a primary care physician, and you'll need referrals to see specialists. PPOs, or preferred provider organizations, are more like the adventurers. They offer more flexibility and allow you to see out-of-network doctors, though it might cost you a bit more. Then you've got EPOs, or exclusive provider organizations, which are kind of a hybrid. They offer a network of providers like HMOs, but you might have more freedom to choose your doctors. Finally, there are POS plans, or point-of-service plans, which offer a bit more flexibility than HMOs, but less than PPOs. It's all about finding the right balance between cost and choice. Now let's talk money. Nobody likes thinking about it, but it's crucial when choosing a health insurance plan. Don't just focus on the monthly premium, that's just part of the story. You've also got to factor in things like deductibles, co-payments, and co-insurance. It's like trying to solve a math problem, but instead of finding X, you're trying to figure out how much you'll actually pay when you get sick. A deductible is the amount you pay out of pocket before your insurance really kicks in. Think of it like the cover charge at a club. You've got to pay it before you can start enjoying the benefits. Co-payments are fixed amounts you pay for certain services like a doctor's visit or prescription, and co-insurance is the percentage of the cost you share with your insurance company after you've met your deductible. It can be a lot to wrap your head around, but taking the time to compare these costs can save you a ton of money in the long run. Don't be afraid to whip out a calculator, grab a spreadsheet, or ask a financially savvy friend for help. Okay, imagine this. You've finally found a health insurance plan that seems perfect. It's got all the coverage you need at a price you can afford. But then, disaster strikes. You find out your favorite doctor isn't in the plan's network. Talk about a buzzkill. That's why it's so important to check for network coverage before you commit to a plan. You want to make sure the doctors, hospitals, and specialists you trust are on the list. Otherwise, you could end up paying more for out-of-network care or, even worse, having to switch doctors altogether. Most insurance companies have online directories where you can search for providers in their network. Don't hesitate to call the insurance company or the doctor's office directly to confirm. It's always better to be safe than sorry. Trust me, Your future self will thank you for doing your due diligence. Alright, we're in the home stretch. We've talked about the nuts and bolts of health insurance plans, but now it's time to talk about the bonus features, the extras that can make a real difference in your healthcare experience. Think of it like choosing a new phone. Sure, you need it to make calls and send texts, but those extra features like a great camera or a long battery life can really sweeten the deal. Health insurance plans are kind of the same way. Many plans offer additional benefits and services beyond the basics, and these perks can vary widely from plan to plan. Some plans might offer telemedicine services, which let you have virtual appointments with doctors from the comfort of your own home. Others might include wellness programs, gym memberships, or discounts on healthy living products. It's all about finding those extra benefits that align with your lifestyle and healthcare needs. Do you travel frequently? Look for a plan with good travel insurance coverage. Are you trying to quit smoking? See if your plan offers resources or support groups. These extra perks can make a real difference in your overall well-being. Okay, I know. This part isn't as exciting as talking about bonus benefits, but it's important. Before you sign on the dotted line for any health insurance plan, you've got to read the fine print. I know, nobody actually enjoys reading pages and pages of legal jargon. But trust me, understanding the terms and conditions of your plan can save you a lot of headaches down the road. Pay attention to things like coverage limits, exclusions, and pre-existing condition clauses. Coverage limits are the maximum amounts your insurance will pay for certain services. Exclusions are specific services or treatments that aren't covered by your plan. And pre-existing condition clauses can affect coverage for health issues you had before you got the plan. It's all about being informed and knowing what you're signing up for. If you're not sure about something, don't be afraid to ask questions. Call the insurance company, talk to a benefits coordinator, or consult with a healthcare professional. It's always better to be clear on the details up front than to face surprises later on. So there you have it, folks. We've reached the end of our health insurance adventure. I hope you feel a little less lost in the wilderness of healthcare plans and a little more equipped to choose the right coverage for you and your family. Remember, finding the right health insurance is all about finding the right fit. Just like a good pair of shoes, it should feel comfortable, supportive, and ready to take on whatever life throws your way. By understanding your own healthcare needs, comparing plan types, evaluating costs, checking network coverage, and considering those extra benefits, you can make a decision that gives you peace of mind. And hey, if you're ever feeling overwhelmed or just need a helping hand, don't hesitate to reach out to a health insurance expert. We're here to help guide you through the process and answer any questions you might have. This is Laura C. from Anchor Health and Insurance, LLC, licensed professional. Thank you for watching. Hit subscribe for more content, and don't forget to give a thumbs up if you liked it.